everybody. I'm Emily with the Food Bank, and we're here at our mass food distribution for Montgomery County. I'm here with the American Heart Association. This is Tim and Beth. We asked you guys earlier to send in some questions to ask them, and you came through. So we're going to get started with eating healthy, which is obviously very important for your heart and the rest of your health. So the question we have is, what are some ways people can eat healthy while on a tight budget?
So the mission of the American Heart Association is to be a relentless force for a world of longer, healthier lives. And there are a lot of ways to have everyone's life be as long as possible and be as healthy as possible. But one of the most important ways to have a longer, healthier life is to eat a healthy diet. And so we're here at this mass food distribution event because having access to the foods that are nutritious and healthy is one of the key, most foundational parts of being a healthy person. So having access to food is really a key component to having a longer, healthier life.
And along with that, to the question, some people just don't have access, right? So events like these, it's important. We were just talking about how many people actually know about it. Well, we see there's a lot of people here, so that's great. Lots of fresh produce here, which I think is amazing. That's the kind of stuff a lot of these folks may not have access to. So along with other organizations in the community like you guys, like CareSource, we're really trying to get this food into the hands of the people that need it most. But how can they do it regularly? Whatever they have, whatever they've got access to, if you're doing something that has a label on it, read your labels, see what's in your food before you eat it. That's one way to do it. And just be aware. As we tell people, be aware of what you put in your mouth.
Fantastic. And Gail Matson asked, how dangerous is cholesterol to heart health?
So cholesterol is a very important risk factor for heart disease and stroke. And the American Heart Association and American Stroke Association just updated our guidelines for medical providers within the past year for cholesterol diagnosis and treatment. The most important thing with cholesterol is to really understand your numbers. Part of your cholesterol is your biology, your gene pool, and part of it is also what you eat and what your physical activity is. But it really just starts with understanding your numbers and partnering with your medical provider to improve what you are able to improve upon.
Next question is pretty interesting. Lou Resource asked, when can we expect nanobots to help keep our cardiovascular system running clean?
So nanobots. I don't know. So what I will say is that there are things that we do today that are done in the medical field and the medical technology field that we could not have imagined even in the near past, let alone the distant future. And so there are robots that can perform heart surgery. There are things that are being done now that were just a dream in the past. So now what I would say about things like nanobots is that I imagine there are things that are going to be happening in the near and far term future that we can't even imagine now. So hopefully we're always looking for ways to get better, which is why it's so important to us to invest in research, to learn and discover new ways to help people be as healthy as possible.
And I'll add to that, we are making lots of groundbreaking discoveries. Our scientists, most of the money we raise at the American Heart Association goes to research. So a lot of people now are living longer because of medical research and medical science. But unfortunately, we still have to do the work on our own part, right? So we should all still try to eat the healthy diet, do the exercise, do the work to keep our hearts healthy. We always tell people it's not that difficult. You don't have to throw yourself into a marathon run, which that would be crazy, but just try to move more and try to eat better. So a little bit at a time, little steps.
Okay, sort of moving back in the direction of food, this next one's about SNAP. It says one policy you're focused on supporting is funding for SNAP, or the Supplemental Nutrition Assistance Program. Why is SNAP important?
So SNAP is a critical link in helping people have access to healthy, nutritious food. There are millions of people who receive SNAP benefits. The majority of them are children or the elderly or disabled people. And it's because we can't be healthy without access to healthy foods. That's why it's important to help support people who need those benefits, receive those benefits.
Great. Are there other things we can do for a healthy heart?
Yeah, so the Heart Association, one of the ways we evaluate success with building healthier lives is we have what we call Life Simple 7, which are 7 categories that are not only a reflection of your current health, but also predictive of what you can do to have your most predictive long-term health. So the 7 categories are cholesterol, blood pressure, your sugar level, as well as your physical activity, your nutrition, your weight management, and then your tobacco use. So we have a tool you can access on our website called My Life Check, where you can get an individualized score as to where you are in each of the 7 categories. But those are the best things that are not only reflective of your current health, but predictive to if you're trying to make improvements on those categories, that's what you can do best to have a successful long-term health improvement.
And to add to that, those categories were identified by scientists, and so we didn't just pull them out of a hat. So long-term scientists and doctors looked at what are the 7 most important factors related to heart health, and those were the ones that
Because really, I mean, we've learned a lot about heart disease and stroke, and among the things we've learned is that there are, in a lot of ways, many of heart disease and stroke risk factors are preventable. So anything we can do to prevent those risk factors from developing is a worthwhile investment in doing.
And our last question, how can people reach out to the American Heart Association to help out?
So our local office is in Kettering. Our office itself is not very large, but we do have a lot of great volunteers who always need more. So if you have a passion for health, for healthy food, for physical activity, just for general heart health, or health and well-being is what we're all about now, and you'd like to volunteer, we just ask people to either go on our website if they have computer access, and it's heart.org/Dayton. You can send us an email through the website, or you can call us at the office, and we're 937-401-4860. That's the main number. There's a way to leave a message if we're not there with 5 of us. There's a lot of in and out, generally 8:30 to 5, Monday through Friday. If you're in Kettering and you'd like to stop by, you can ring our doorbell and we'll help you however we can. We do have a lot of resources available on our website as well.